You were done? Because I'm waiting for you. Okay, that's okay. Good afternoon, everybody. Welcome to the GMC April membership meeting. Wow, look at all this turnout. This is good. If you're not here, if you are there theoretically people watching on video, you're missing a party. This is good. I'm Greg Marcus, President and CEO of the Marcus Corporation. It's great to see so many of you at the U Club today. More members are joining in person every month. We're streaming today's meeting via Zoom. I guess I shouldn't have asked if you were streaming. In theory, I've read these comments before. If there are technical difficulties, we will email a recording to all members. I'd like to welcome new GMC member, Keith Trafton, CEO and Managing Partner of the Bartolotta Restaurants. Keith, here you are. And our special guest, Mayor Cavalier Johnson. In addition, we're joined by our friends at Advocate Aurora Health, supporting today's keynote, and their CEO, Jim Skogsbergh. Jim's here today to discuss how 4 years, oh man, how time flies, 4 years after the merger between two major health systems, Advocate Aurora is tackling systemic issues within our community through their commitment to health, equity, and thriving communities, and being a part of our community. And Jim, I thank you. You did make that commitment when you came here, and you and your team have held true to that. You are still an important part of our community, and we're grateful for that. Before we invite Jim to the stage, Joel Brennan will be sharing GMC initiative updates. Welcome, Joel.
Everybody should feel free if you haven't, dig in. We have people getting up and leaving our table here, so all of you should start going. Good afternoon and welcome to everybody here. As Greg said, we are getting larger in person as time goes on, and it's exciting for all of us. I think we have all this pent-up momentum and energy about gathering together, and a lot of the reason why we're doing that, a lot of the reason why we've had challenges over the last couple of years have been surrounding health and public health. And it's really great that we have our guests here and Jim here today to talk about that issue. I want to note just a few things around some exciting initiatives we're doing, some fundraising success, and even some new arrivals that I want to make sure everybody's aware of. First, starting off with the initiatives around economic prosperity. As most everyone is aware, Elmer Moore, the former executive director of Scale Up, has started his new position at WIDA. I can tell you that Elmer and I have had occasion to talk a little bit about that drive back and forth to Madison and what you do on that drive. And Elmer has described the process as drinking from a fire hose, which all of us can be familiar with that. But he's doing well in his new role, and I think looks forward to continuing some of the momentum we have around housing and economic development issues in Milwaukee. But the rest of the Scale Up team, Elizabeth, Deshaun, Jared, have been truly focused on making sure that we execute on great planning in 2022 and making a big impact in our community. Scale Up this year has a full schedule of program offerings for growing businesses in our region. We're in the midst right now of the 7th Spark cohort. That includes 21 companies, 16 of those are women-owned, 18 minority-owned, making their way through that Spark curriculum. We're also hosting in just a few weeks, on May 25th, the first in-person Meet the Makers event in 2 years. This will feature the growth story of Matt Ziegler, president of ZMAC Transportation Solutions. Matt participated in Scale Up's 3rd Growth Accelerator cohort, when his company was about a $12 million company in revenue, and ZMAC is now a $100 million company. So having him tell his story and share that with other participants and with the community is something that's important, and we look forward to being able to do in person in just a few weeks. The Scale Up team will also launch the 8th cohort of Growth Accelerator this summer, and a rejuvenation of their membership platform. I want to recognize as I mentioned, Elmer has now been in a different role for the last several weeks. I want to recognize the important work that has been done both by that team, both during and following Elmer's tenure. I got the chance to participate in a very thoughtful conversation last week led by Chancellor Mark Monet with some of the people who were some of the founding vision behind Scale Up about what we can do to both broaden the impact and look at how we can collaborate even further with others in the community on that moving forward. So I look forward, and I think all of us on the staff look forward to those conversations in the weeks to come. Next, I want to talk a little bit about the MKE United team, and I'll start by saying that that team has expanded by one. Most of you know Tony Panciera, who leads that effort for us. Tony and his wife Amanda welcomed their daughter Vivian late last week, joining big sister Zoe, and so they had an even more special Mother's Day as a result. So Tony will be on leave for a few weeks, but Erica and the rest of the team will be certainly continuing to do work, and the MKE United effort continues to make a lot of impact in the community. A particular area of focus for MKE United has been the creation of a pipeline into appraisal careers for underrepresented communities. The pilot will focus both on diversifying the field with individuals who bring a unique understanding of the community assets, while also addressing bias in overarching systems contributing to the historic devaluation of homes in Milwaukee's communities of color. That appraisal pilot is scheduled to launch in June with initial recruitment. Our partners in this there are several in the community, but especially Employ Milwaukee. With that partnership, the participants will receive paid training to engage full-time in the program. Lots of people here are aware, and we've announced before, that the effort previously received about a $900,000 grant from the state of Wisconsin through federal ARPA funds that'll help launch and sustain this program over the next 3 years. In just the last few weeks, MK United was selected as one of the spotlighted innovators and awarded a cash prize for its appraiser diversity initiative in the Ashoka and Brookings Institute's Valuing Homes in Black Communities Challenge. The purpose of this challenge is to identify structural innovations that are focused on redesigning a more equitable housing market, addressing the factors of systemic racism in Black majority neighborhoods around the nation. We're excited to bring these national funds to this important work and the work that we can do in the community in the weeks and months to come. On the innovation and talent side, the GMC and Home Group have begun another cohort of Forward 48, the region's premier leadership development program for young professionals. We want to express our thanks to Dr. John Raymond for presenting at the first session last Thursday at Discovery World. Having spent a little time with that group after Dr. Raymond was done, I can attest that we have another eager, inquisitive, passionate group of leaders taking part in Forward 48 this spring. They'll engage with many of the leaders in this room and many leaders in the community over the next several weeks. And I want to express appreciation to all of those who have a hand in making this program happen in the city of Milwaukee. That commitment to talent development is also reflected in the upcoming kickoff of Fuse Boot Camp, which is a collaboration between the Commons and MKE, the Milwaukee Tech Hub. Fuse is a unique summer boot camp experience designed to build skills that apply to any tech or tech-adjacent career. The program provides an exploration of the ethics and impact of data and AI, artificial intelligence, across southeastern Wisconsin's key industries for students in all areas of study. Also this week, we'll host faculty members and students from the Harvard Business School for a couple of different reasons. First, we have a dinner and a program tomorrow to kick off this year's YALP program, the Young American Leaders Program. John Kissinger and Grafe have been supporters of this program for the last several years. It sends 10 community leaders to Boston and the Harvard Business School later this summer, but we'll start with that conversation this week. Some of those same faculty members and current HBS students will also be in the community to reflect on some of the challenges and opportunities. I know that this group has at least a dozen or more places that they're visiting, people they're talking with in the community. And so, again, I want to express appreciation. These are important things to do in the community, and what we get out of this is better and more than what we give. So I appreciate everybody who has worked on that. Finally, we're pleased to announce that the Beerline Trail Capital Campaign has reached and exceeded about 10% of its fundraising goal. While the campaign has not yet publicly launched and there's still work going on behind the scenes before that, the leaders, the community are making great strides on this project. A couple of weeks ago, on a day not as nice as it is today, and the mayor can attest, I joined the mayor, alder people, Julia, a number of others, city staff, neighborhood stakeholders, in walking the Beer Line Trail and just getting a better sense from those stakeholders about the vision around this and the work that this will, when this work is accomplished, what it will mean for equity, for energy, for opportunity within the Harambe and River West neighborhoods. So on a day like today, when at least spring, maybe summer seems to have sprung upon us, I would invite you to think about taking a walk along it or a bike ride along that, just to envision for yourself what this will mean. And as you hear more in the months to come around this campaign and this process, just experience firsthand what this is going to mean for neighborhoods in the Milwaukee community. So with that, I have the opportunity to introduce today's program. As most of you know, 4 years ago, one of Wisconsin's largest employers, Aurora Healthcare, merged with Illinois-based Advocate Healthcare to form Advocate Aurora Health, led by President and CEO Jim Skogsbergh. Beginning in 2002, Jim served as President and CEO of Advocate Healthcare, the largest health system in Illinois and one of the largest in the Midwest. Jim was named as one of the 100 most influential people in healthcare by Modern Healthcare for nearly a decade. He's been featured in local and national news publications as a leading voice on healthcare transformation and innovation, national healthcare reform efforts, quality, cost, high reliability initiatives, patient safety, and healthcare providers' commitment to serving their community, something that's been reflected in Advocate Aurora's Health, their work in Milwaukee over the last several years. Under his leadership, Advocate Aurora has been recognized as a national leader for its clinical successes, technological innovation, workplace culture, and safety excellence. Jim joins us today to discuss the accomplishments, challenges, and opportunities related to that 2018 merger. Following his presentation, he'll be joined by a panel of collaborative partners, including Nancy Hernandez, President of the Hispanic Collaborative, Jenni Sevenich, CEO of Progressive Community Health Centers, and Keith Stanley, Executive Director of Near West Side Partners. The panel will be moderated by Christy Garcia-Thomas, Chief External Affairs Officer at Advocate Aurora Health and a Greater Milwaukee Committee board member. We're very fortunate to have a chance to lean in on these issues with Jim and his team today. So please join me in welcoming Jim Skogsbergh.
Good afternoon, everybody. Thanks. Pleasure to be with you and to talk a little bit about our organization and kind of what's been going on the last 4 years. I think the first in-person, Joel, am I right? First in-person was the last meeting? Was it 2 before? But I look around and some of you folks I haven't seen for like 2.5 years. And in fact, some of our own team members I haven't seen other than on Zoom. We're still remote first for Advocate Aurora. And so the opportunity to be in the same room in person with folks is, I don't know, it's kind of a delight. So it's a pleasure to be with you today and to talk a little bit about our healthcare organization. I've got some slides here that we want to go through. It's maybe intended to stimulate some conversation, perhaps. And I'm really comfortable if you guys would like to just interrupt as we go if you want to ask a question or probe or so on. I'll be on and off here in about 25 minutes. And Christy, keep me honest on that, would you please, so that we can get on with the panel. Excited about that as well. What we want to do today is talk about the 4 years past. So we came together in 2018, and I think I can say this with the folks in this room, there had to be just a little bit of trepidation when Aurora Healthcare, an absolute, a magnificent asset for Milwaukee and for the state of Wisconsin, hooks up with an organization down in Illinois, out of Chicago, right? Like, uh-oh, what's happening here? And then there was a leadership change, and I was selected as a CEO. So we know that there was some anxiety around what's going to happen with this great community asset. And we want to tell you sort of what has happened in the midst of an unbelievable worldwide pandemic and how we conducted ourselves. And we feel pretty good about where we are. I'll preface all my remarks with this. Much more work to be done. As good as some of these numbers are, much more work to be done, and we will be about that work in the months and years ahead. So when we came together, we committed to 5 things. And we did this publicly, and some of you remember this, but we said, hey, we're going to expand access to what we consider to be world-class care. All right, expand access to healthcare, which is always an issue for every community around the United States. Expand access. We want to transform care delivery. We've got to make healthcare more personal. We've got to make it easier. We want to transform who does the work, where does the work get done, how does the work get done, et cetera. The belief that transformation is necessary if we're going to accomplish all of our objectives, because keep doing it the same way, we're really going to have the same outcomes. You all know that. So we're talking about transformation. Obviously, the need for all of us, and it's been exacerbated in the last year or so, is the need to attract and keep the very best talent. And we knew that coming together, we had a great deal of confidence coming together we could do that. Accelerate innovation and partnership, and so many people in this room are our partners, and we feel so fortunate to be working with you on these very important efforts. And then the last is to enhance the consumer experience. Again, mostly the idea of making healthcare not just more accessible, but easier, right? This notion of getting closer to the consumer, closer to the patient, closer to the customer. Those are the commitments that we've made. So we sort of want to tell you how we've done. One of the key messages is we've made significant investments in this community. Now, statewide, it's like $2.6 billion, but we're going to give you some numbers here for Wisconsin shortly. We've added nearly 5,000 jobs, almost 4,000 of those in Wisconsin. All right, so we're adding jobs, and Mr. Mayor, we talked earlier this morning, but we think that's a good thing, folks. We think that's a good thing for our economy and for the communities that we serve. We've got a real commitment to, I'd call it a laser-like focus on safety. And one of the tenets of safety, and there's a science around safety, as many of you in the audience are aware, but the science around safety is, one of the quips is you can't improve what you don't know, right? You got to identify things first. So we focused on reporting incidents, and we got our reporting up, and now we're going to drive down our serious safety events. And that's something that every hospital in the United States should be focused on, and we are laser-like focused on improving safety. Community benefit, we've increased our contributions significantly. It's almost $7 billion of community benefit that's gone up since the last 4 years. We've grew our business diversity spend. Joel referenced that from the podium just a couple of minutes ago. This notion on, are we investing in women and minority-owned businesses? And we are, and we're doing so in a significant way, and we're proud of that. $220 million annually in that regard. As a result of this transaction of bringing together Aurora and Advocate, we've got an increased brand awareness of 20%. We think that's good, folks. It's a competitive marketplace, and brand awareness is something that's important to us, and that's gone up. We've launched a business that's allowed us to invest in health-related businesses, not just the inpatient, outpatient, home care that you think of when you think about health systems, right? Any of those that are here in Wisconsin, here in Milwaukee. Lots of inpatient focus, tons of outpatient focus, and a big investment in home care. We're all that, but we're also, as part of our getting closer to the consumer, the customer, getting involved in health-related businesses, a staffing company that we now own a part of, those kinds of things. A dietary company that delivers meals for particular disease to patients that would benefit from special meals and so on. So we made that investment, and we feel very, very good about that. And then we're, again, back to the notion of making things easier for folks. I don't think there's anybody in this room would say, yeah, please make it more difficult, right? Nobody thinks that way. We've got our own LiveWell app with 1.5 million downloads, and so folks are being able to get their information, schedule things, get the results back, and so on, talk to their provider in a much easier fashion. So we're very focused on that. So that's delivering on our commitments. In terms of social impacts, and this is a repeat, $6.8 billion in community benefit, $50 million supporting minority businesses in underserved neighborhoods, $175 million in philanthropic donations, which is a 35% increase in the midst of a pandemic. The spirit in our organization is one of serving. And this is one of those examples of stepping up philanthropic support, 35% increase. All 27 of our hospitals, a perfect score on the benchmark index regarding LGBTQ and health equality leadership. So we feel great about that. Sustainability, we're serious about carbon neutrality. We're serious about net positive, and we're taking steps to do even more in that regard. Partnering, as I said, folks in this room employ Milwaukee to increase underrepresented populations, access to healthcare careers. And then we have a dedicated, our board has dedicated a committee to diversity, equity, and inclusion. Not all healthcare organizations have done that. We have, with a very serious focus on DE&I, and a couple of our board members are here. Tom Bolger is with us today. Chuck Harvey is here with us today. And these are folks that live in this community, care deeply about this community, and help lead our organization, govern our organization to these fine outcomes. So let's talk about Wisconsin. That's kind of the AAH number, but here's Wisconsin numbers. As I said, key highlights, $4.4 billion in community benefit, 41% increase just in the state of Wisconsin. $1.3 billion in capital investment just in the state of Wisconsin. So to be more specific, and New Mount Pleasant Hospital has got 2 clinics. Sheboygan Replacement Hospital will be opening up in July. Pleasant Prairie Outpatient Surgery Medical Office building opened last year. 84 South, which is an ambulatory surgery center. This is the access part. Remember that first commitment? Expanding access to world-class healthcare. We're doing it and have done it over these last 4 years. A brand new clinic in Kokana. Was it, Jeff, 2 years ago, approximately? Yeah. Continue with these highlights. As I said, over 4,000 jobs in the last 4 years that we've increased, which is great for our economy here. A 12% increase. Whose wages hasn't gone up, right? This is not a bad time to be a worker because wages are just screaming in terms of increases, and certainly in healthcare. So wages have gone up dramatically, and that's a great thing for the ability to, not only care for your family, but send your kids to school and all those things that are so very important to all of us. And the wage increase helps that. We have seen an increase in our people of color representation in our workforce by almost 22% here in the state of Wisconsin. We've seen a 46% increase in people of color management representation here in Wisconsin. And as Dr. Jeff Barr, who leads our medical group, likes to say, our doctors are staying with us. That's a very low turnover rate, and that is a great thing as well for the people of Wisconsin. Low turnover amongst our medical community, and that is good news. More highlights. We've expanded support to 125 community partners, many of which are here, certainly at this table are good partners, and others, because we're not going to accomplish the objectives we have if we're not in partnership with one another. It just does not happen if we're not working together, and we have a great working relationship we feel wonderful about. We've awarded $2.1 million in grants to 10 community service agencies through the Better Together Fund, making those continued investments. We have, anchor strategies here around, really, really important social determinants of health, right? Everybody knows housing, that impacts health, people's individual health. Food insecurity, food deserts, we're making investments there. Workforce development, that notion of getting young people interested in healthcare, great jobs, great benefits, staying in the community, being productive members of the community. Workforce development's important to us. Community safety, because we see the results of an environment that's not safe. We see the results of violence in our emergency departments and in our clinics. We see the results of behavioral health issues in our organizations as well. So that safety is so very important. Access to innovative solutions we've talked about. Behavioral health services, most of you are aware that we're partnering with the other providers to establish a facility for psychiatric needs here in Milwaukee, and that's a joint venture, that's a joint partnership, that's a collaborative thing, which is so very important. We've talked about our community investment. I think you've caught our numbers on business diversity. So our community and anchor strategies are alive and well. This is the kind of the example or the explanation of each one of those that we've talked about, and specific examples, the food pharmacy in Kenosha, et cetera. This is work that continues. It's certainly a lot that's been accomplished in the last 4 years, but you never pronounce success or that you're finished. This is going to continue because these needs are not going away by any stretch. Again, Near West Side Partners here today, Keith, MLK YMCA event that we've supported, the Anchor Collaborative, so very important. United Way, a great partner for us, and things like mobile dental care and MMAC, Diversity and Equity Inclusion Pledge. So we're part of all that with most of you in this audience. That's our story 4 years later. That's an eye test, by the way. We will not quiz you. But it's a way of capturing all the good work that's been done in 4 years. And I've had a chance to communicate with many of you in the last couple of weeks on this eve of our 4-year anniversary. And I concluded my communication with you in a way that was intended to drive home that while there was some nervousness about what's going to happen to Aurora as a result of this, I think we sort of answered that definitively. And Aurora has never been stronger than it is today, and we feel good about it. Not because of Skogsbergh, but frankly because of some of the people in this room, and you know, in Illinois or in Wisconsin, 37,000 of our team members, and the talent and the commitment and the unbelievable passion that our people have for service to those that are in need of it. That's why we've had some success. But I would also say this, more mergers are going to happen. That's our future. I guarantee you there's going to be more mergers. There will be more leadership changes, right? And heaven forbid, I suspect there might be another pandemic or two before the lights go out for all of us, right? So we live in that world of constant change. Here's what will not change: our commitment to Wisconsin and the Milwaukee community. That is steadfast. So you can take that to the bank. We've had a good 4 years. We're going to have a great next 4 years. So let me stop there. Thank you all for the time that you've given me to kind of tell this story. But more importantly, let me just turn it over and see if you have questions. Healthcare is probably the #1 issue anybody has on their mind these days. I am more than happy to address whatever questions you have. And frankly, I'm surrounded by Advocate Aurora team members that know a lot more than I. So all the tough questions will go to the people in the audience. Please, any question about what was covered? Yeah, Corey, please.
Interested in your perspective, someone down in Illinois, about how you found the Wisconsin market as you got to it. And any big surprises for you as you've seen this market over the last 4 years?
Yeah, great question, Corey. And you weren't that obnoxious. You were direct, and I love that. You know, so here's what I would say. No big surprise, to be honest with you. I have found that the communities we serve are so remarkably similar. The marketplaces are a little bit different, clearly. I think Wisconsin has I'd almost say more of a pro-business mentality. We've got some other challenges in the great state of Illinois, the land of Lincoln. And Abe is rolling over in his grave as we say that. So there are some significant challenges there. I think it's a very healthy environment here. Unbelievable community collaboration, which is wonderful to see. So whatever surprises I had were all positive, and people have warmly greeted me and continue to support, you know, the great work that we do. So it's been, I mean, I get to pinch myself every day. I will say this, that the timing of the pandemic was interesting because those of you that followed this transaction very closely, it wasn't that long after we kind of came together that, you know, we're hit by a worldwide pandemic. And as my colleagues would agree, here's two organizations striving to become one. Okay, doing all the things, appropriate things that are necessary to come together as one organization, right? And doing it very deliberately and having great success in that regard. But then come along the pandemic, and I have said, I've been public about this. While the pandemic was financially an unmitigated disaster, financially, and we benefited significantly from federal funds, folks. Absolutely, we benefited big time from that. But while it was a disaster financially, it was a blessing culturally. And what I mean by that is we go into this pandemic with two organizations striving to become one. We come out of this pandemic as one very strong organization. And it's been wonderful to see. So I think it's nothing but you know, blue sky and tailwinds for us going forward. Tremendous challenges in healthcare, believe me. But the way we've kind of come together, I'm betting on us. We're gonna handle all that stuff. Yes, please.
Maybe loud enough without it. Wanted to ask, what do you think, Jim, are the most important lasting impacts of the pandemic? For example, on telehealth, or what are some positive things that it may have, some trends that it helped accelerate in a good way?
You're right, and I love the question because, you know, let's face it, folks, we must make lemonade out of lemons, right? We must look at these as opportunities to learn and to adapt and to innovate and so on. I do think telehealth is one of the first things I'd go to. You're not going to put that genie back in the bottle. Now, there still are people, and Jeff sees this every day, there's still people that want to come to the doctor's office and see their physician, right? Got to be, and we want to accommodate that. But we also have folks that are saying, hey, this works perfect for me. You know, I don't have to make that travel. So telehealth, I think, is one of those things. The other thing that's changed for us, you know, candidly and sort of in the confessional here with my dearest, closest friends, we learned early on about the need, the importance of deference to expertise. When you get into a pandemic, it doesn't matter what your title is anymore. It matters, what do you know? And our infectious disease docs and our clinical leaders, both nursing and medical, you know, led for us. And that's staying with us, this notion of deference to expertise and surrounding yourself with people that can drive this, you know, this agenda that we have. And I think that's been a very, very good thing. I think the notion that we went remote has been good. And I'll tell you why, because we have reduced our real estate footprint. And every dollar that we don't have to spend in real estate, I know there are real estate people in the room, but I'm telling you right now, every dollar we don't have to invest there, we can invest at the bedside. And that's really where we want to spend our money. So we've got sort of a hybrid approach, but it's remote first mentality. And we've been able to shrink some of our real estate and frankly, try to make healthcare more or less expensive, right? More affordable, and that's been good. So those are a couple things come to mind. Yeah, great question, thank you. Yes, sir.
There's a front page article in the Wall Street Journal this morning about healthcare groups raising prices due to nursing, primarily wages. And all of us are facing higher wages in our business, I'd speculate, but we also have a huge overhead cost of healthcare. Yeah. So what's Aurora Advocate looking at there? Where do you see the industry?
Well, I'll tell you what, the notion that wages are going up, they will continue to go up. So we are absolutely in an environment where there's not enough caregivers for the demands. And that supply and demand is a very real phenomena. So we've made unbelievable increases in salaries and wages. Now, you asked about nursing. We're talking about across the board. First thing we ever did was our entry-level jobs. Made a big increase in our entry-level jobs because we were having trouble just getting people in to do some services that we've really never had challenges before in terms of food service and housekeeping and those kinds of things. Big increases there. Now, this is not all good news for those of us that pay bills, right? Because that increase in wages has absolutely increased our expenses. But here's the thing that most of you probably know, and that is that we don't get to turn around and go to our payers and say, hey, we had to do a 17% increase in wages. How about if you increase your reimbursement to us to cover that? That's not how it works in healthcare, right? So we have to make that up ourselves, which is why the innovation comment is so important. We got to learn how to do it better, faster, more efficient, more effective. So I hope I'm answering your question. We're going to see wages continue to increase, and that's going to put tremendous pressure on your healthcare providers. And I'm speaking for all my colleagues here in Milwaukee now, or the state of Wisconsin, or frankly for the country. And that is tremendous challenges financially when you see that line of expense increase going up and your reimbursement doesn't change. That's the challenge we have. Other questions? Are we good on time? Got one more? Take one more question? If you have it. Please, yes.
Talk about social determinants of health.
Yeah.
I'm wondering, for a follow-up on your question, you compare the Illinois market to the Wisconsin market. On those determinants, on the social determinants of health, where are we ahead, where are we behind, and as a community, where do you think we should be focusing in that regard?
Yeah, the short answer, and Christy Garcia-Thomas would be able to give you chapter and verse. The short answer is I don't know about ahead and behind. These are the same issues in every community. Now, maybe the housing problem is more acute in downtown Chicago. Maybe the food shortage might be more acute in Milwaukee. I don't know that. Christy would. But these are the same issues in every community across the country. And I would say the differences are degrees of difference. So we got a big lift in Illinois, and frankly, as the mayor and others would know, we got a big lift here in Milwaukee, folks. We got a big lift, and we're going to lean in with all of you and others in this community to address those needs. But yeah, I'd say same issues. Yeah. Why don't I exit? Christy, I think you're going to sort of MC this discussion, this panel discussion. So thank you all for your time. And Christy Garcia-Thomas.
Thank you, Jim. And I'm going to ask my panelists to come ahead and join me up on the podium while I'm introducing them. And I think it's a great segue because what our panel of experts are going to be sharing with us today is the work that we're doing collectively in the community to truly address the social determinants of health. And at Advocate Aurora Health, our purpose is to help people live well. And we recognized years ago that in order to fulfill that purpose, we had to do more than provide exceptional clinical outcomes, which we do each and every day. But we had to also become very active in our community at addressing the social determinants of health. And as we look at our community, and to your question around the market, so life expectancy gap in Milwaukee, depending upon the zip code you're born in, but if you're born in 53206 compared to where my daughter was born in 53097, it's a 16-year life expectancy gap, 16-year difference, just based off of where you're born. In Chicago, it's a 21-year difference based off of the zip code you're born in. And 80% of what drives that life expectancy has to do with the social determinants. 20% is your health care. So the 80%, and we know this through our community health needs assessment, is that our biggest challenges, not only in Milwaukee, but in Chicago and across the United States, is access to health care, access to behavioral health, food insecurities, housing, employment, and economic prosperity. So we knew when we took on this work years and years ago that we needed to partner in the community. And about 4 years ago, we decided we were going to double down on our efforts. And even through the pandemic, we said we need to do more because the needs are greater. As you all know, those inequities that exist in our community became a very bright light during the pandemic. We saw huge differences in all of these particular areas. And we know that we can't do it without great partners. So I've asked, we have many partners. I think Jim mentioned we have about 125 partners who we work with throughout the state of Wisconsin to really address these issues within our community. But here in Milwaukee, we've asked 3 of our partners to help be a part of this conversation. And so what I'm going to do is I'm going to ask each of you to introduce yourself, talk a little bit about your organization, and then maybe weave in a little bit about the partnership that you have with us before I start, asking some more direct questions around some of the needs within our community. So Keith, I'll start with you.
Good afternoon, everyone. How you doing? Come on, you guys can be a little bit more energetic. There we go. Keith Stanley, I'm the Executive Director of the Near West Side Partners. I've been at the helm of the organization since it started in 2014. Advocate Aurora Health was at the very beginning of that partnership. We focus on 4 areas: safety, housing, commercial corridor development, and health. And there's was a focus, as we all now start to see each other in person, there was a focus really about health in the Near West Side, serving not just our 30,000 residents, but also serving 350 businesses we have. And so that partnership with Advocate Aurora Health is really focusing in on how do we serve that community.
Since Keith got you revved up already, I'm Nancy Hernandez. I'm the head of the Hispanic Collaborative. Okay, can't lead in. What we're about something called a Hispanic Wellbeing Index, which is really, we track 20 different variables about our Latino community here, roll that into a composite index. And we do the same for the 50 top metros in the US to understand how are Hispanics performing here and what can we study in those top performing cities that maybe we can adapt here in Milwaukee. Right now we are 44th out of 50, and our goal is to become the top 10. So that's really what we gear towards. We are a backbone organization, meaning my job is to bring together community partners around a shared goal and a shared mission to bring investment to the table in order to achieve those shared goals and move us to top 10. We have a lot of partners. The GMC is one of our partners. MMAC, certainly we're housed out of there. And they track, it's not a coincidence that they're tracking per capita income and we track median household income. And we're both about lifting that boat. We partner with HERA, with many philanthropic organizations, and certainly Advocate Aurora Healthcare has been one of our big partners, especially in the area of workforce development. We are trying to increase median household income, so upskilling and reskilling a population that has high employment levels but high levels of poverty is key to our success. And we're also working with them on strengthening economic stability within our communities by investment into Latino-owned businesses.
Hi, everyone. I'm Jenni Sevenich. I am the CEO of Progressive Community Health Centers, and we are a federally qualified health center, FQHC, or community health center, located on the north side of Milwaukee. We have 3 locations in the heart of the north side of Milwaukee. We provide medical, dental, and behavioral health services, as well as social work, health education, financial counseling for the people that we serve. And we can't do what we do without partners. And so Advocate Aurora has been a major partner of ours in many ways. And just to touch on a few, we have a co-located location in Sinai. We have an urgent care right next to the emergency department at Sinai, so that people who are seeking primary care treatable primary care treatable issues and who are intending on going to the ED to address those have a choice of going to the urgent care instead. And that is giving them treatment, right place, right time, right location, and getting them connected to a primary care provider that they can then engage with long-term. We also partner with them in terms of our OBGYN services. Our OBs, they deliver and they do surgeries at Sinai. And we have a call pool with Milwaukee Health Services, which is another FQHC in the city. But the red, we call it the red team, the laborists at Sinai provide backup for those teams. So no matter what, when a patient from Progressive or a patient from Milwaukee Health Services goes into Sinai to have their baby, they are going to have an OBGYN or a nurse midwife there ready for them to deliver that baby in a way that is sensitive to their needs. And then we also partnered on a Transitions Clinic Network model program, which is a model of care that provides healthcare access as well as access to other resources for people re-entering the community from incarceration, and many other ways, but those are just a few of the highlights.
Thank you. As you can tell, we've got great experts here, and the benefit not only in partnering strategically and making sure we're providing services back to the community with all of our partners. Another great advantage for us is they give us access to the voice of the community. And it's really important that we co-create solutions with the community, because like all of us, nobody wants to be told what to do. They want to be a part of the solution. There is a lot of scientific facts out there that suggest that creating an inclusive culture and building a collaborative environment ensures adequate financial investments into the community and lead to better creation of community. Nancy, I'll start with you and let you answer your thoughts and your approach to how you create that inclusive environment with your constituents.
Thank you. So, I would say certainly some of the things that you mentioned, inclusive culture, collaborative environment, financial investment, and that place for people to be passionate and creative, those are certainly some of the necessary ingredients. But we can often, if I'm sitting in my kitchen and I have all the ingredients necessary in front of me to make a cake, we're not guaranteed that I'm gonna have a cake at the end of my process, right? Unless I'm very intentional about my process and specific in my goals, which is I wanna come out of this with a really tasty cake. And so that the same thing I think is true when we think about those things that you talk about. We have to be intentional. We have to have a systems change mindset for that. And that's really about understanding what are some of those root causes and the strategy necessary to transform them at scale. And so I think those are key things that we need to think about, right? It's not just about those ingredients, it's about really having that systems change mindset and the specific process behind it. And so we need to really describe the system that we want to change. We need to understand what contributions we're going to make that improves that system. And then most importantly, we have to ensure that those improvements are creating long-lasting change, impacting the communities that we want to impact. So I'd say you got to add some of those things.
Thanks, Nancy. Keith, as you think about that question and Nancy's response, how would you think about it for the Near West Side Partners?
Well, I would say I want to peel it back a little bit. I think I want to acknowledge Advocate Aurora Health. Those of you who are familiar, Milwaukee natives, you may be familiar with the Near West Side. Near West Side lost 6 hospitals and a university over a 50-year span. You can imagine what that does to a community. And to have Jim and the team support Aurora Sinai being there, one of the last hospitals in the Near West Side, is so important. So for me, I want to start there because I think it's important for a community-based organization. Secondly, as I think about access and connecting resources to our community, having leadership at the helm who are willing to listen to our residents, engage residents. We have Vincent Lyles on our board, and we're communicating. So we're connecting with College Court residents. College Court is a public housing outfit. And connecting those residents to those who are trying to figure out how to serve them is so important. We're creating platforms for our residents to speak to the issues that concern them when it comes to their health, and Advocate Aurora has been helpful with that.
Thank you. Jenni, you have anything to add to that?
Yeah, I'll just add that we start with our staff because we hire from the community that we serve. And so making sure that they have a sense of belonging in the organization and of course in the community, and listening to them with regard to what issues they're dealing with and their childcare issues and how the pandemic has affected their neighborhood has really informed our work, in addition to our patients and the neighborhoods as a whole. And belonging to those community groups, belonging to those neighborhood groups is so essential, just as a member of the group, not as a leader of the group necessarily, like Near West Side Partners, you know, the healthcare group that we have, and also, you know, things like the Washington Park Partners or other just smaller neighborhood groups. Having a presence there so we can listen is important.
And Jenni, I'll follow up with that. So you referenced the model, the business model, and the coexisting clinic that we have on Sinai's campus, and that's been in place for almost 10 years, I want to say. And when we started down that road, there was a lot of anxiety maybe around that approach. Now thinking back, looking back at it, what do you think were the challenges, and then what's been the advantages that have come from that partnership that I know early on was, you know, it was different. It was a different approach to addressing the community.
Right. Well, having progressive community health centers, urgent care inside of Sinai, where there's, you know, so first we have 2 different brands, you know, so we have to make sure that people realize that we are progressive community health centers, and the emergency department is Advocate Aurora. The challenges come when, you know, with the EMTALA law, when people check into an emergency department, even if they have just a sore throat or an earache or something like that that we could treat at the urgent care, the emergency department has to give them a medical assessment by law. And so they can't just say, hey, there's an urgent care right there. It's, you know, they can serve you, and they can take care of your sore throat or whatever, and the bill is going to be a lot less, and you'll probably get seen a lot faster, you know, with some emergency department wait times. That can't happen. And so that has been a challenge. So trying to figure out how to help people self-select to go to the urgent care for issues of the urgent care nature and go to the ED for emergent issues. But we also, you know, if people do find themselves at the urgent care, but they really have a higher acuity issue, we have a transfer process that is seamless. So we can transfer them to the ED seamlessly. You know, obviously we can't do that the other way around, but at least we can get them the care that they need in the emergency department if necessary. The advantages, of course, have been that the lower acuity visits that were being seen in the ED, many of them are now being seen in the urgent care. And so that leaves room for the ED to do its work of high acuity care. And so it doesn't necessarily mean that fewer people are going to the ED. It's just that they're seeing people who do have higher acuity issues and then have higher admit rates. So we know it's working in that sense because we do look at that data. And then we're also being able to connect people to a primary care provider at one of our other clinics that they can engage in primary care so that they're not constantly seeking primary care in an urgent care or an ED, and they get long-term care.
Thank you, Jenny. I think it validates getting the right care at the right time is so critically important to addressing, you know, chronic disease, to addressing some of the really significant challenges that we see in our hospital, and the partnership has been great. Keith, I'm gonna direct a question your way as you think about the Near West Side Partners. We're proud to be a partner, but there are 5 major institutions that partner with you and with the community. When you think about having a variety of stakeholders at the table, how do you see that impacting, you know, what are the challenges of that, and what are the benefits that have come to the Near West Side Partners because of the key stakeholders?
Christy, I'll start off with the benefits. The fact that we have these 5 major stakeholders in the Near West Side, committed to the Near West Side at the highest levels, really has engaged or energized and given momentum to the many projects and activities and programming that we're working on, improving the safety of our residents, making sure there's better, higher quality, affordable housing, bringing in over 50 new businesses, 60% of them are BIPOC or woman-owned. And the list goes on. But I think when we think about the challenges of working with 5 anchor institutions along with our other businesses and our many residents, the term that comes to me is ego. We all have to put the ego to the side, you know, and what makes sense for the community. And there's so, you know, each of the institutions have a lot of history, and not just within the Near West Side, but throughout the city of Milwaukee, the state, and the country. But being able to put that aside and say what's important to developing a healthier community. So I think that's the value add that, at least what overcomes the challenge and the value add that we have when it comes to Near West Side Partnership.
Thank you. I'll throw my last question out to each of you, and then we'll just open it up to the members. So, you know, when you think about the great strength that this city and our region have, and you think about the challenges, you know, what keeps you awake at night? And if you could wave a magic wand, what kind of partnership would you love to see happen for the future of our city? Nancy, I'll start with you.
Sure. So I'd say what keeps me, well, we've talked about some of the challenges, right? On the business side, we've touched on, you know, some of the community issues that we all look at each day in our roles up here. I'd say what keeps me up at night is helping to create this understanding that this isn't just a Hispanic issue, and how do we bring the level of collaboration and investment to the table that's necessary to address the scale of these issues that we're talking about. You know, Keith's not looking at changing numbers in the hundreds, neither am I, neither is Jenny, right? We're talking about thousands, and that becomes a big endeavor. And so, you know, I look at it this way. If you go to our website, the first thing that you see is, what does Milwaukee look like if we were today a top 10 city for on the Hispanic well-being? What does that mean to us here in this room? And I will say that it means 12,000 more college graduates right now today if we were a top 10 city. It means 7,200 more small businesses in our community right now if we were a top 10 city. It means about 11,000 more in median household income in 47,000 households across the M7 area. And so those are impacts that I think from a business standpoint, we can all see here, right? And a community standpoint, we can all see how we can reap the benefit of it, either from consumer side, investor side, client side, workforce side. We can see how that rising tide would raise all boats. And I think that that's one of the hardest pieces of my job, is how do I help continuously piece these pieces together, your initiatives and our initiatives. I think we're successful on some of those fronts. I think we have to do a lot better with that. And I think collaboration in and of itself requires infrastructure, which we don't have right now. And that's another level of investment that we'll need to consider if we want to be serious about this and start moving the numbers in the thousands.
Jenni, I'll move to you.
Well, one of the things that keeps me up at night is workforce. And that includes across the board, from entry level to physicians and everything in between. The competition is fierce. And as a federally qualified health center, we don't have as many resources as some others in terms of competing for workforce. And so we have to get a little bit creative and figure out how can we attract the workforce and retain them. You know, retention is a major issue. And for all of us, congratulations on your 5%. That's very impressive. And so those two things definitely keep me awake. The other big thing is, you know, just the disparities, and how do we dismantle systems that are not working for the betterment of all, and then rebuild them so that they do work for the betterment of all. You know, there's that saying of every system is perfectly designed to get the results that it gets. And so what do we need to do collaboratively? Because none of us can do it alone. It takes really everyone to be committed to that long term. And what does that look like?
Thank you, Jenni. Keith, last words?
I think there'll be just two items I think that can really concern me, Christy. One would be, of course, we heard it earlier, the safety, getting people back out of this pandemic phase that we've gone through, and getting the after-school programs up and running, getting our young kids active. Then the big one, I think, for the Near West Side is, and I mentioned it earlier, as far as our work, is housing. On the low end, we're looking at 32,000. On the high end, 44,000 housing units that we do not have. That goes to the social determinants of health that we mentioned earlier. Having adequate, affordable housing is so key to our city. And we struggle with that, specifically in the Near West Side, but all across the city. And figuring out how we can tackle that issue is really important for our residents and for our businesses.
Thank you. Well, I would like to open it up to see if there are any further questions for the panel, or even for Jim or Advocate Aurora Health. Happy to take any further questions. Greg?
You know, a quick question, and well, maybe it's not a quick answer, but you know, Jenni, to your point about having to rebuild systems and to deliver to the underserved communities and I think it's a great point. But I guess the question I'd ask you all is, because my thinking on that is, I don't care how many great systems we build, if our community, people in the community do not trust, it won't matter. You can build the best, you can develop the greatest vaccine to deal with a pandemic that you can come up with, at least, at least as it was at that point. But if nobody trusts it, nobody takes it. And what do they say? It's not the vaccine that works, it's the shots in arms that work. And so we just saw it play out, the complete lack of trust. And I think it's a pervasive problem in many areas of our community, but healthcare is a huge issue. So I guess my question to the panelists is, what do we do to fix the trust problem? Not what do we do to fix the system, because that's next. It won't matter if we fix the system without trust.
Great question. I'll start with it. First of all, we strive to reflect the community we serve with the people that we employ, with our providers, and understanding cultural influences to healthcare outcomes. And so making sure that we don't try to always make the patient fit into the system, that was designed without their circumstances in mind. We really strive to be able to accommodate the patient and create a different system of care. Doesn't always work, but that's what we strive for. It really is about having the people who are most affected at the table, and really making sure that they have representation and are able to give their experience, their voice, and it takes time. It takes effort to build those relationships. It's really about listening, really listening, and understanding that, yes, we have to fix the upstream issues, but we also have to pay attention to the things that are immediate needs. So yes, we have to consider the root causes of the violence that we're seeing right now. And we have to make sure that those neighborhoods who say we need more lighting, get more lighting, to address the violence in their neighborhood now. So I would say listening is a really big part of it, and just making sure people are at the table.
I would also add something that I had to learn, and I'm an impatient person, but I had to learn that, the saying progress will go at the speed of trust is really true. And trust is not going to move as fast as you want it to move. So you have to be in it for the long haul. And we have to think about that as we develop these new systems. I'll challenge that our communities of color need to be at the table. They don't need to just be at the table. They need to be designing the solution and controlling the investment, right? I often tell our team, in order for us to make change, and if we think about, there's both internal change and external change that needs to happen in our communities. And in order for us to make change, we either need to control the resources in order to make those change, or have influence over those who do, right? And and we have to think about that as we build these systems, and how do we help them drive the solutions and have the resources at their fingertips to place that where they need to go. And I'll give you an example. During the pandemic, when we quickly realized as the Latino community that we had large pockets of our population that didn't have access to the same level of financial assistance that was available, primarily the federal funding, some of the state funding, and for obvious reasons. And so while we were able to bring some fantastic players, both philanthropic as well as some CARES dollars, to the table to help fill that need, the community came up with a design of how do they quickly distribute, what amounted to about $300,000, $400,000 in a very safe setting, identifying those families that needed it and getting it to them in a system that was safe for everybody. And they did that so well that it was actually the county executive, when he had a pocket of dollars that he needed to also get rid of before the deadline, came back to this community to implement the same process. So those are the types of wins when trust goes both ways. Let's trust them with the design and the investment, and they might trust us back with more uptake.
Greg, I would just add to that, all beautiful answers from panelists, fellow panelists. I will also add, I'm gonna give a shout out, Joe, to the Young American Leaders Program. I was a part of the first cohort in 2018, went out to Harvard Business School for about a week to talk about all these different issues with different players. One thing we came away, and I believe they do it every year, is the common good. I think really getting back to the common good is important. I think sometimes because we're all in our silos and every echo chambers and everything else we're gonna call, that we're not, as a country, as a society, getting back to the common good of what's important for everyone in the community, as opposed to specific audiences. And I think, are these two applications for Yelp? Are there applications out?
This cohort is the name.
Okay.
We're just starting. Last year, they didn't even get to go to Harvard. Those people are still complaining.
There's no other questions. Just a round of applause for our panelists. And I'm turning it back to you, Greg.
Well, in the first piece of bad news, we're not going to go till 1:30 today. Joel and I were talking. Not a crime to not go to 1:30. That's because your time is all valuable. Joel, good leadership. Thank you. Well done. Thank you, Jim and Christy, and the entire Advocate Aurora team for your leadership and commitment to health equity and to our community in general. Your reach is far beyond the doctor's office, creating a chain reaction of systemic change. Thank you to Nancy and Jenny and Keith for sharing your insight into successful collaboration throughout our community. You're very clearly affecting the lives of individuals throughout our community. Keep your eye out for the GMC newsletter with a recap of today's meeting and initiative updates. And one thing I'm going to ask, not related to the newsletter, after today's meeting, we're going to start something new. We're going to send out a survey that we'd like to send out, frankly, after every meeting. This, Jim, to your point of, until you know what it's, by the way, this does not rise to the level of health safety as an issue. But if you don't know what the problem is, we want to measure our meetings. And you get what you measure, as they say. So we're going to send out a survey. And if you'll promise me to fill it out and to fill it out regularly, I will promise you that it probably will take you less than a minute, because it is a very quick survey. And because I don't know about you, but I hate getting these surveys where there's a bar across the top telling me how much percentage I have left, and I usually quit at about 20% because I'm thinking I took this much time already. This is that simple. We're going to use the Net Promoter Score model. Rate us on a scale of 1 to 10. And if you give us a 9 or 10, this is actually probably a 20-second survey. And if it's less than a 9 or 10, we're going to ask, just give us some clues as to what we can do better. Because we want to look at these meetings. I always talk about in our business, we put the bread, by the way, the bread's pretty good here. We put the bread on everybody's table and everybody gets it, right? So everybody touches it. Do not give somebody a bad piece of bread at a restaurant, because I don't tell the Bartolotta guy all my good tips, but but you have good bread too. So you all touch these meetings. This could be our biggest touch on all the GMC members. So we want these to be valuable and to be important. They won't be unless we get your feedback. So give us a rating. We're going to keep score, and we'll report out our scores so you know how we're doing. So thanks very much. Our next meeting is June 13th, highlighting ARPA and CARES funding. How can we leverage these dollars for greater community success? We'll see you all next month here at the University Club. The meeting is adjourned.